If we go back 20 years, there was a lot more radical invasive surgeries that we've been able to study really well and realize that we can do something less and achieve the same cancer outcome. And by less, it usually means lessening the recovery time, lessening the impact on the patient's life, both work and recreation. And where that's really borne out in cancer is also related to some of the newer technologies and techniques of what we call minimally invasive surgery, laparoscopic and robotic surgery, where we're studying and trying to make sure that we can achieve the same cancer outcome, but with quicker recoveries, less morbidity, less toxicity, earlier return to work, earlier return to recreation, that sort of thing. The other thing that I think we're getting a lot better at, and the sort of holy grail of cancer, is prevention. So it's one thing to have better treatments, but if we can catch it earlier or catch it when it's pre-malignant and deal with it before it's a full-blown cancer, that would be the home run that everybody's hoping for. And I think that's going to be something that we really see take off in the next 20 years. The research is what will set the tone for the next 5, 10, 20 years. So the things that people are discovering in the lab now that are a huge part of Siteman's effort are translated into early and then later clinical trials. And you could go through a myriad of examples of things that in the past 20 years were discovered in a lab here and are now standard therapy everywhere. And that's, I think, part of the Siteman name and reputation and power, is that we have literally discovered things that are now standard therapies and benefiting millions of people. My birthday wish would be, if the productivity of the first 20 years can even be half of that in the next 20 years, then Siteman will be doing phenomenally well. I'm sure it'll be a lot more than that, so I have no reservations to say that when Siteman turns 40, it will be at the top of the cancer centers in the world.